Good morning. I'm Bill Patton, Interim CEO here at Sublette County Health. I'm giving you a board report from the meeting that was held last evening, December 17th. This was a regular meeting of the board. As we have been doing in our past videos, we are visiting a different part of our new building. We are in one of the Heritage Home apartments. This is one of the ones that is double occupancy. So for example, if a husband and wife wanted to be admitted, or sometimes I've seen two sisters want to be in rooms like this. So just another example of the wonderful new facilities that we have, thanks to the support of the local community, the hard work of the board and the leadership team, the employees, the medical staff. If you haven't had a chance to come and visit us, please do. We love to show off our new facility. So the meeting last night started as a normal meeting does: Pledge of Allegiance, passage of the consent agenda that last night only included minutes from regular meetings and executive session meetings. The board then moved into committee reports. It had a report from the building committee. The board took some time to discuss how to handle a change order that they had received. After they dealt with that, then they also had authority to pay some of the construction related bills. We're almost done with that. It is interesting how long it takes to wrap up a project of this size, but we hope to have it done, if not by the end of December, then early in January. The board then heard a report from the foundation. Carrie DeWitt, the executive director of the foundation, gave a report, and the highlight of the report was that the fundraising effort for our new grand piano has successfully been completed. If you recall, this piano is worth about $55,000, but it was made available to us for only $20,000. The foundation was able to raise that money in a very short period of time, and as of just a few days ago, completed the $20,000 fundraising campaign. So we will be able to make payment, and the piano will officially be ours forever and ever. We've been able to make good use of the piano. A number of concerts have been held. I attended a Christmas concert recently. The piano is just wonderful, and the acoustics of the room where it's in really complement the fine instrument that it is. We didn't have a finance committee report. Board meeting was a little bit earlier this month because of Christmas, and there were a couple of issues, special adjustments that needed to be made, that we needed to consult with our auditors. So financials will be reported at the next meeting in January. We then had operations report. A number of the departments that report to me had submitted written reports. I had no additional information. Dom from Health Tech had a report. Tanya Hoffman, the board chairperson, had submitted a number of questions that Dom presented answers to. So that was a good report, and then I went into my report. I'll come back to that in a second. I want to finish up the rest of the board meeting, and then I'll conclude with my report to the board. In old business, the board approved all of the bills. The board reviews all of the invoices and the checks, as well as the payrolls. Last night the amount was a little bit over $3 million that was approved. According to current policy, any bill that's over $20,000 needs to come to the board, and so there were a number of bills that fell into that category. And then after that was done, they actually reviewed what's called the delegation of authority. This is the document that defines the dollar limits and the type of projects that require board approval or approval by the CEO or the medical staff. We've been working on updating this document for a number of months, and last night was the final review. I'm happy to report that the board has approved that updated document. It will actually streamline things in many respects for them as well as staff. An example would be, current policy is that bills over $20,000 have to be approved by the board. In the new document, that threshold is raised to $50,000, or if it is a number that is included in our budget. An example would be pharmaceuticals. It's very common for us to have bills related to medicines that exceed even a $50,000 limit. That would be a normal number that we would expect. no reason for the board to have to approve a number like that. So I think it's a good step forward as the board evolves and moves away from oversight of the hospital construction project and more into a governance role. The board then approved or voted on new officers for the year. Let's see if I can get this from memory. Tanya Hoffman was re-elected as the board chairperson. Ashley was the board vice chair. Let's see, Kenda was the treasurer. Taylor is the secretary. And then they created a new position, a board governance oversight position, and Jameson Ziegler was appointed to that. So now all 5 board members have offices. So that was nice to have that done for the year. The board approved 2 medical staff contracts, advanced dermatology and paintbrush pediatrics. And then the board approved the hiring of 2 new mid-level or advanced practice clinicians. Tara Ryan, a doctorate of nurse practitioner, hired for urgent care, and then Jacqueline Stain, also a PAC, physician assistant certified, hired also to work in urgent care. And then to move to my report to the board, we reviewed an updated organization chart with the change in CEO and with Lindsey Bond's departure. The need to redo the org chart was necessary, so I had worked with the senior leadership team, and we presented the board with my recommendations on what the new org chart would be. Typically, boards don't approve an org chart, but we do want to get their input, so we had that conversation, and the new org chart will officially be published today. Gave the board an update related to our efforts to convert to critical access status. We've just completed a 3-day mock survey in preparation for that. The mock survey went very well. We've already begun making a number of the adjustments that were found during the survey. Happy to report, though, that there was nothing big. The surveyor commented on how much progress has been made since the original survey to open the hospital. We have filed our application with the state. That application has been received. It has been deemed complete, and the state is going through a 6-step review process. They have indicated that they will expedite it as much as they can, but now that we're in the holiday season, you know that things often get slowed down. Once we get that review completed, then we'll be able to have our application to CIHQ. That's the organization that will actually do our critical access survey. We're going to pre-file that so that we can get in line. I'm guessing that it's probably going to be the 1st or 2nd week of January at the soonest that we'll have that inspection. And then we filed the paperwork that's necessary to allow us to bill for Medicare and Medicaid going back to September the 16th. We received a status report on that just yesterday. They are issuing our fee schedules. We need to have those fee schedules in place before we can start billing. They are hoping to have that by the end of this week, and my fingers are crossed. We really would like to start billing for Medicare and Medicaid. We could use that cash flow. I gave updates to the board regarding people. We have successfully hired a new revenue cycle director, Mariah Smith. Mariah will be starting with us Monday of next week. We had a leadership development training. We took our leadership team down to the Sublette Center, had an all-day team building event. We did a book club, a book called Eat That Cookie by Liz Jaswick. And we did a community service event where we cleaned out some of the vacant resident rooms that will be turning into offices, and we also did some cleaning in the rooms that will be turning into a dormitory space with the support of our foundation. We've updated our call policy. We've implemented a new charge nurse differential. We've implemented a new nurse preceptor differential, and we're going through and standardizing our titles. Last month, I had presented to the board a new structure for titles and what each of those definitions and responsibilities are. Based on that document, we're now updating so that we don't have all these different titles and different people having different levels of authority, we're standardizing things throughout the organization. We're going to address the PTO conversion deadline that had been placed in policy because people weren't able to take time off while the hospital was being built. We're going to push some of those deadlines back. I talked to the board about creating what I call a compensation philosophy policy, and the board was in agreement that we should do that. It will lay out our ambitions as far as the level that we are within the market, the 50th percentile, for example, the process by which employees will receive wages that will do cost of living increases, merit increases, and performance increases. So the board gave me permission to work on that document. I'll be taking it back to them in the coming months. Also talked about some of the employees that need to have their rates of pay looked at based on years of experience. So the board gave permission to work on that. I'm working with the medical staff to come up with a quality process for reporting timely completion of charts. Right now we don't have a formalized process for that, so we're going to start collecting that data and reporting it to the medical staff every week so that they know where they stand on completion of charts. We need that for good quality care. We need that for the ability to bill. So gave the board that update. We've had presentations by 2 different companies to have their helicopters stationed on our helipad. These projects will come at no cost to the district, but told the board that we're going to be looking at that. We're going to be looking at a process to standardize some of the payments that we need to make, the contractual payments we make to our medical staff. Up until now, some of those haven't been as timely, so we've made a commitment to the medical staff to do that. One of the things you may have heard or may have experienced yourself is lab pricing here in our Pinedale clinic and in our outpatient laboratory. Apparently, when those charge masters were built, when the new hospital was being opened, there was no connection to the charges we currently have been paying or what the Marbleton clinic pricing was. So now that we've seen the problem, we're going to go back and fix it, and we plan to have that completed by the end of December. So if you've been driving to Marbleton to get your lab work, you're not going to have to do that anymore. We're looking at our FTEs as far as a revised budget for the next year, especially departments that are putting in a lot of overtime. I gave the board a summary of a number of contracts that I'm reviewing as we look at ways that we can affect reductions in our expenses, looking at contracts that we currently have and whether we need them or whether they could be revised down. That's work that we're doing. We've standardized our purchase of medical gases. We used to buy from 2 companies. We're now going to be buying from 1. We've also consolidated all of our purchasing for our dietary department under a single company. We continue to work on a permanent solution for meals for the tenants in the Aspen Grove and Heritage apartments. Until we have a permanent solution, we're going to continue to provide those meals. So if you hear that we're cutting it off, until you hear that from me, that's just not the truth. We're going to continue to provide those meals until we have another permanent solution. I talked with the board about the meetings that we're doing with the county commissioners. We recently met with the Marbleton City Council, with the Big Piney City Council. We want to have regular meetings with our elected officials so that they can know what's going on at their hospital. And then I notified the board that I'll be taking time off over the holidays, but even though I won't be in the office, I'll still be available if something comes up. Board went into executive session to talk about a number of issues, legal issues, personnel issues, contractual issues, all issues that are protected by law. As always, I hope you have found this update useful. I'd like to wish you a very Merry Christmas. Take care, and if you have questions, give me a call. Thank you.